topic. That's why I'm here. I'm Dr. Danish. I'm the medical director of Wellward Regenerative Medicine, which is a clinic on the other side of town where the old Eagle Creek Library used to be. My area of specialty, I started off as an anesthesiologist, and then I went into pain management, and then I went into musculoskeletal and regenerative medicine. A lot of people hear regenerative medicine and they ask me, well, what's that? Because it sounds really cool, right? Regenerating your body, kind of like a salamander, you can grow a new tail. Right, yeah, right? But it's not quite like that. Well, what we do is we try to understand what within the body is not functioning correctly and thereby causing pain. And then once we can identify that problem, then we can start working towards how does your body heal in general, and how can we optimize that to heal on as well as it can. And that's essentially what regenerative medicine is. There's a lot that takes place in the body as we age that can cause pain. And the question is always, well, why is it that some things get better and some things don't and become a chronic issue? And so today we're going to take one area of the body and look at that in a little bit more detail to understand why, for instance, back pain starts and just continues to go on. Does anybody here have back pain? Or has had back pain in the past? Or know of anybody who's had back pain?
I have had it sometime or other.
Yeah, it's the number one reason people see their doctor is for low back issues. So it's helpful to understand how that evolves. I brought
And also your hands.
And also your hands. Well,
yeah,
you can actually use what I'm talking about today and apply it to really any other joint in the body, and it's a very similar process, but just slight differences. So this was my last patient who didn't listen to what I was telling him to do. But
wow. You mean we're all going to end up like that?
If you don't listen to what I say.
Oh boy.
Clearly this is plastic, it's not a real person. But this is essentially what your spine looks like. And if I were to overlay this on my own body, it would look something like this. And so what I'm going to do is we're going to focus on this area right here, which is kind of
the coccyx.
Not the coccyx. So the coccyx is all the way down at the bottom.
Oh boy. Yeah.
I'm talking about more the lumbar and sacral area.
Oh, okay.
Which is really the area that's most commonly affected. So first thing is, what you guys notice about the spine?
It's flexible.
Right, it's flexible.
Oh. It's a little crooked.
It's a little crooked. So why do you think we have this shape? Why isn't it just one straight column?
Because of our ribs, they need to find space.
So it's true, it needs flexibility, but the other thing to keep in mind is what's stronger, a spring or a column?
Probably a column.
A column is stronger, but if you put a lot of pressure on a column, it's going to buckle and break.
That's true.
Whereas if you put a lot of pressure on a spring, it's going to bounce back. And so our spine has a curve to it, and it's intentional, because what that does is it makes the spine like a spring. And if you think about all the weight of your body is falling down onto this structure right here, we need something that's fairly resilient, that's going to be able to bounce back if there's a lot of pressure on it. So how does the spine do that? Because it's rigid like a column, and yet it allows us to move around like this as well. And it does so with a combination of hard structures like the bone and disc, and then soft structures like the muscles of the back. So what the muscles do is they redistribute the pressure at various points so that when you're standing or when you're moving, the pressure that's on the spine is targeted to the areas that are the strongest. So if you imagine like a suspension bridge, the bones and the discs of your body would be like the pillars going into the water, and then the muscles are like the suspension wires coming down. So as I walk across that bridge, every time I take a step, those wires are coming down and holding that pressure. And then when I take the next step, the next set of wires are taking that pressure. But what they're doing is they're evening it out so that the bridge that never sees pressure all in one spot. It's able to distribute that. But as we age, one of the things that's happening is, you notice that, our skin starts to develop wrinkles. Well, what's the difference between somebody who's got wrinkles and a child who doesn't? It's the strength of the connective tissue. It's the strength of the layers of tissue in between the muscles, in between the skin, within the fat. All of that is keeping things together and keeping it tight. But as we age, we lose that resiliency, that bounciness of our tissue. And so all of these muscles start to become less reactive, become less responsive to the different pressures of the body. So as I'm walking on this aging bridge, what's happening is that some of these wires are breaking, and they're not able to take the load at that area. And so the body has to compensate for it. And what it normally does to compensate I'm going to take away the muscle and bring up some ligaments. I'm going to squeeze in here. Is everybody following where I'm at in the body?
More or less near the stomach? No.
We're near the back, the spine.
The spine.
So what I want you to, here, just to give you an orientation again, here's the body. I'm looking at the back, and I'm going to squeeze in here and just simply look at the spine. Now, notice all of these structures. See all the ligaments here, and here, and here, and here? That's kind of our secondary guard. When the muscles start to break down or not work the way they should, the weight is then distributed to the ligaments, and the ligaments start taking the load. Now, most people don't notice that transition. They don't notice that as we age, that our muscles aren't doing what they're supposed to, the ligaments are doing so. Whenever they tell you, why should we keep good posture, a lot of that is because we can take the load off of our ligaments and put it on the muscles and keep the muscles strong. But if the muscles break down, then the next line of defense is the ligaments, and then if that goes on for long enough, the ligaments will start to break down. But the body is a dynamic machine. It's always changing and it's always adapting. So when the ligaments start to see a lot of stress, they'll start to thicken and harden and get bigger. So if you look at somebody's spine, the difference between somebody young and old is that in somebody young, it'll look something like this. But as we age, what's going to happen is the ligament around this joint and this joint and this joint will start to thicken and harden and get thick and get bigger. What that does is it creates some stability. But the downside of that is if it's growing in an area that doesn't have a lot of space, that's when we get problems. So how many people have heard of spinal stenosis? How many people know of somebody who has spinal stenosis? And have you ever noticed what's common among all of these people? That they'll walk with hunched over. Or if they're at the grocery store, they'll lean over on their cart. Well, why is that?
Take the pressure off.
Right, to take the pressure off. So, if you imagine this spine, if we take a look inside of here, there's a tunnel. And within that tunnel is where your spinal cord runs. So, what do you think would happen if this ligament, this one right here, was now taking more load than it was built for and is starting to thicken? What's going to happen to the inside of this canal?
gonna roll out.
It's going to start to squish that canal, right?
Yeah.
And so progressively as time goes on, this is a very slow and gradual process of that ligament inside of here thickening and eventually causing compression within that space. So, for instance, if I were to, what is your name?
Betty.
If I were to take Betty and I sliced her in half, I'm going to do that, Betty. Oh.
Ouch.
But if I sliced her in half and looked down into the center of her spine, I should see something like this, where it's a nice round circle. But what happens as we age is because this ligament is thickening, we're not going to see that nice round circle. We're going to see kind of a triangle forming. And I can pass some of these out so you guys can see what this looks like. Let's see. And I guess there are no page numbers, but you can probably find that. Thank you. You're welcome.
I have a
Yes,
question
fire
for
away.
you.
And please ask questions if you have any.
Okay. You just explained something about the back.
Right.
Well, when they first started it, they would put something around your ankle for
When they first
bungee
started-
jumping. Now they put a suit,
Oh, bungee jumping.
bungee jumping.
Yeah.
Now you're required to wear a suit because they found out the cords were snapping and people were losing their lives.
Yeah.
I won't do it because I don't want to watch my life flash before my eyes and then be yanked back up.
Yeah, I'd rather flash
But
before my
what
eyes than
does
just
that
jump.
do to the spinal cord?
It's a good question. So,
Because you're talking about them shifting around,
yeah.
and I'm talking about what does it do when the body gets jerked up? Because you're talking about them being moved around.
Right.
Well, what happens when this happens?
When it's tugged on.
Yeah.
Well, same thing that would happen if I jump up and come back down. Our bodies are built to carry some degree of resiliency and capacity. And presumably, most people who do that are strong enough and healthy enough where that kind of a force isn't going to create damage. But you're right.
Right.
I think that it can, and we just need to be aware of that.
But what about like instructors and stuff for bungee jumping? Over time, what's it going to do to their back?
It's a great question, actually. So the question is, what about instructors who do bungee jumping all the time? Does everybody know what bungee jumping is? It's where they tie a thick rubber band to your legs and they throw you off a cliff, and hopefully that rubber band holds.
Yeah, hopefully.
Hopefully. So,
I'd rather try sushi instead of bungee jumping.
who wouldn't? So what happens with repetitive stress, essentially, is the question. What happens if somebody is constantly jumping with a bungee cord? That's the beauty of the body, is that
It will mess up the body so bad.
if it's done gradually, if it's built up over time, the body actually adapts to it, and the body gets stronger. So, for instance, they looked at people who are marathon runners versus people who are not marathon runners. Now, a marathon is 26 miles. It's quite a long distance to run, plus all the training that goes into it. Who do you think has healthier knees, the marathon runner or the non-marathon runner?
The marathon run.
The marathon runner.
Why?
Because he's slowly been.
Because the body adapts.
Yeah.
And we have this notion that our bodies are like a car. The more you use it, the more it breaks down. But it's exactly the opposite. Machines erode. The body adapts. The body is a constantly evolving machine, and it's constantly adapting. Now, our ability or capacity to adapt changes with time. We become less and less able to adapt, but it doesn't mean we have zero ability to adapt. We still have significant ability to adapt. Otherwise, if you cut yourself, it wouldn't heal, right? Because that's a form of adaptation. If you cut yourself, it heals. And that shows that the body is constantly changing and working on improving. So whatever stress you introduce to the body is actually going to make it stronger with the assumption that the structural stability of that part of the body is intact. And going back to the spine, if the structural integrity of the spine is intact, meaning the muscles are strong, the ligaments haven't broken down, they haven't thickened, they haven't started to enclose on the spine, then the body has the capacity to adapt to the stresses that are introduced. But when there's a defect in the body, when there's a strain in the muscle, or a tear in the ligament, or that joint has already thickened to the point where it's causing other problems, now we have an issue that may not be able to adapt. And that's where pain comes from, is from the halting of how the body adapts to the environment. It's what our body's capable of doing. If it's hit a roadblock, what we need to do is figure out what it is that's become the obstacle, clear that obstacle out of the way, and then teach the body how to continue to adapt. So what this procedure, the mild procedure, does is it looks inside that spinal canal, and rather than going in and with surgery opening it up, we can go in with a tiny little straw and shave out that ligament where it's gotten thicker. So previously, what would have to happen is they would have to cut away all of these muscles that we talked about, how important they are. They would have to cut away all of these muscles, and we already know how important these are because they are the shock absorbers. They distribute the weight on the back. So, and if you cut a muscle, does it form back exactly the way it was?
No.
It doesn't. It creates a scar. And so you either have to break that scar down with exercises, or you live with that scar. And the problem with scars and muscles is that it changes the way the muscle pulls. So if a muscle is pulling like this, and I put a scar in here, now all of a sudden the muscle may be pulling like this. It's not going to carry the same capacity as a normal healthy muscle will. And so over time it creates another problem that may need to be addressed. So with surgery, they would have to cut away this muscle, and then they have to cut away this bone so that you can get underneath it and open up that ligament. Now, this has been a better solution than not for many people for many years. But I think that this is the next evolution of how we can address healing within the body without creating as much disruption. The analogy I use is like if you had to, every time you had to change the oil in your car, you had to cut away the hood. Well, over time, what's going to happen? You're not going to have a
You're not going to have a hood.
Yeah, it's going to be like my jalopy. Not going to do a whole lot. And that's the point that I'm making with this, is that we want to be as minimally invasive. We want to be as little involved with the body, with the normal biological functions of the body as we can. And this procedure is one of those innovations that allows us to open up that space without disrupting the muscles, the ligaments, the bone, because all of those things are necessary to help distribute load. Does that make sense?
Yeah.
There's a question back here.
That makes sense because they were talking about having surgery on this side because I fell somewhere and I got sick, and for a while they thought I had Wagner's disease because I had a spot on my lung. Well, they tested the scar, the spot, which ended up being the scar. They go, oh, it's just a normal scar. Something's healing up.
Right.
So then they took me off the medicine that I was on and this and that and the other. So that's good news that they didn't actually have to perform surgery.
If you can avoid surgery, if there's an alternative to surgery, it's a better choice. If there's an alternative. And I'm not going to say that there's everything that surgery can completely be done away with. There is a need for surgery. But I think that as time moves forward, we need to continue looking for how we can fix the body without invading it like surgery would do. And there are certain things that have evolved that really allow us to do that. This is one of those things. Now, keep in mind that the stenosis is really the downstream product of other problems, meaning that the joint is still irritated, it's still being pulled on. The muscles may not be functioning the way they should be. So what that means is that this procedure isn't going to fix everything. It's going to improve stamina, it's going to improve the ability to stand up straight and walk for longer distances, and it'll improve some of the pain. But there are other contributors to the pain that also need to be addressed. And that kind of goes into this comprehensive picture of understanding what's going on with this body and what do we need to do to help not only fix the existing problems, but also set up the domino so that you have a better chance of these dominoes staying upright. Meaning we have to also address whatever other weaknesses there are in this body to make it more resilient, more robust, and able to maintain that stamina.
How about bursitis?
Great question. So we're going to shift topics a little bit and talk about bursitis. What is bursitis? First of all, what is a bursa? Does anybody know?
Fluid between.
It is. It's a gel between layers of muscles. So, for instance, one of the more common areas of bursitis is everybody following where I'm at? I'm at the hip.
Yeah.
One of the very common areas of bursitis is right here.
Oh.
Right? The trochanteric bursa. Has anybody heard that before? This is your trochanter, and there's a cushy layer over which these muscles have to run. And so
So it'll be
Right.
around here.
right, so I'm talking about this area here. Bursitis is when there's been enough irritation built up over time where that jelly that's supposed to be the cushion starts to break down and it erodes. A lot of people will inject steroids into that. I advocate that that's not a great idea, because if you lower the inflammation of that jelly, it'll reduce the pain for a while, but then it'll come back with the added disadvantage that jelly is now broken down more.
So you will have more soreness, in other words.
Right, so there's a lot right now that's evolving within healthcare where we've been focused on the short term for so long, we're missing the bigger picture. And bursitis is one of those situations because it's often the tendon that's the bigger problem, not the bursa. And if you can fix the tendon, if you can heal the tendon, then the bursa heals on its own. It'll get better on its own. It's not necessary to just bombard it with steroids. We can actually work on fixing the tendons, and then the bursa will get fixed on its own. Does that answer your question?
Very interesting.
I heard there's no cure for bursitis.
That's because they have that short-term perspective in mind. If we take a big step backwards and we look at how the body heals, what happens when there's damage that's causing pain, and we can understand that process better, that evolves solutions that are more long-term. It's not just a last resort kind of scenario. And that's really the purpose of our clinic, our practice, is we want to help educate the community, both everyday people as well as healthcare providers, that if we focus on just the short term, if we just focus on the symptoms and try to fix the pain without looking at the diseases causing pain, then we're always going to have this chronic pain scenario where problems are just going to keep accumulating. But if we can take a step back and start looking at the body in a more comprehensive fashion, understanding how things move, how stresses are distributed, where your body is harboring vulnerabilities to stress, then we can start to build plans that really evolve long-term outcomes rather than just short-term outcomes. And I make that distinction. I say, there are two perspectives that you can take. We can either get you comfortable immediately, but recognize that we're not doing anything for the big picture, or we can recognize that there's a long-term perspective that we need to take, and we can get you as comfortable as we can in the short term, but our goal is on the long term. It's to optimize you so that we can maintain your functioning for as long as your body's capable of doing so. We're all on this slope. When we're born, we're like here, and then when we pass away, we're down here, and it's a slope like this. My goal is to make it more like this, and then, we're not going to live forever, then you go. But we want to maintain this for as long as we can. We want to stay on a flat plane as long as we can. And that's where some of the regenerative mindset comes in, is we're trying to keep the body optimized mechanically, cellularly, chemically, nutritionally, all of that. We're trying to maintain as healthy as we can for as long as we can until the body really cannot continue. Yes.
Well, you're talking about the body adjusting,
Yeah.
whether you're a runner or whatever. But when you stop doing those things that the body adjusts to, that means your body's already adjusted to you doing it. So when you don't do it, that basically leaves the body already adjusted.
Your body is going to continue adjusting.
But what if it doesn't adjust, is what I'm saying.
So then we need to look and see where the obstacle is.
Like if you quit running,
Uh-huh.
now they have already proven that the pounding of running
Is helpful.
is helpful.
Yep.
But treadmills, they slowly ruin your knees, that people don't know. Like
Not
they get
necessarily.
really active.
Not necessarily.
Well, I have a doctor looking into it.
People will have different
she's
opinions.
studying, and it tears up your back too.
So
But
people have different
she
opinions.
says
on
it's
that.
healthier to do normal running than on a treadmill.
I would agree. So
Anyway,
so not running is not as healthy as running on a treadmill,
so
which is less than running on pavement.
what I'm basically asking is, like a bungee jumper instructor that does it all over. His body is adapting, but once he stops, and let's say he gets up to 90 years old, is his body gonna be where he's got to get knee replacements, or
Not
Uh-huh.
necessarily.
Tell me
Not
about it.
necessarily.
I got metal things.
So yes, if he stops bungee jumping, the knees are gonna adapt to not bungee jumping. So it may start to weaken over time.
okay.
Joint replacements, I think, is a good conversation, because we've gotten so aggressive with replacing joints. I've had patients tell me, well, I don't want to do anything about my knees because I'll just wait till it needs replacement. Our bodies aren't replaceable like that. I mean, the biology is always going to be superior than the mechanics if we can sustain and maintain that biology. The difference between a knee that gets replaced and one that doesn't is that the load distribution every time I put my foot down is not just felt at my knee, it's felt at my hip, it's felt my ankles and my back. And the body has been designed in a way that distributes that pressure evenly. When I take the knee out of the picture and I replace it with something mechanical, that's going to put more stress on other structures. Now, sometimes it doesn't matter. Sometimes it's irrelevant, because if the knee is feeling better and you're moving more, well, that's a good thing. But if we can manage that knee so it doesn't need to be replaced, and that's possible, then the outcomes are going to be better. Does that make sense?
Yeah.
I have 2 knees that have been replaced, and I don't have that excruciating pain that I used to have.
That's great. That's great. And I'm not bashing knee replacement. I'm not saying that there's never a reason to do it. There absolutely are reasons to do it.
Oh yeah.
But there are also tools that can prevent us from developing to that point.
Oh,
because
okay.
if we look at knees, let's look at knees for a minute. So what you can notice is there's a whole bunch of muscles
Yeah.
that surround the knee.
Right.
And they're functioning to both be a shock absorber, meaning
Yeah.
every time I put my foot down, the muscles are going to take that weight, and rather than just keep it at the knee, they're going to distribute it all along my thigh. So there are muscles, and then there are also all these ligaments holding things together,
Ooh.
right? So what's going to happen if there's a small tear in that ligament?
Ah, that'll be painful.
Then the joint is no longer working the way it was designed. It's going to start sliding side to side.
Ooh.
And if it wasn't designed for that left and right sliding.
No
So-
wonder it hurts so much.
Right, so once that ligament starts to break down, it's going to cause that joint to move side to side and cause other structures to break down. Now, what if we were able to find that tear before the joint starts to move like that? And then we were able to fix that tear without having to actually go inside the body and do things surgically.
How would you fix it? I
So
mean,
that's where the regenerative therapies come in.
oh,
Is
okay.
we're able to look at this knee under an ultrasound and examine it, look at how the knee is moving, and identify structures that are starting to break down. And then before the knee actually gets to that point of no return, we can try to fix that so that there's greater stability to the knee and allow that knee to function the way it was designed to before it gets to the point where it starts to erode the cartilage and break down entirely.
I was using ice packs and everything on my knees, and sometimes it didn't relieve
No,
any.
and
No
what's
relief.
important to recognize is that when we're talking about joints breaking down, we're really talking about 2 different things. There's pain, and then there's function, and they're not always the same. We assume that if it's hurting, that means it's breaking, or that if it's not hurting, it's fixed. And so a lot of what's taken place in healthcare is we've been so focused on the pain that we forget about the function, and we wait until the function is beyond the point of return to do anything about it, and that means a knee replacement. And what I'm saying is we need to use the pain to understand what's going on with the function so that we can fix it early enough to where it doesn't need a replacement. It's like, let's go back to that car model. If I never change the oil in my car and I just say, I'll just replace the engine when it breaks down. Does that make sense?
No, it doesn't.
No,
It doesn't.
Because
That's-
you may end up with a piece of trash that you cannot go anywhere.
You don't know what kind of engine you're going to get from that repairman.
That's right.
So what I'm trying to do is change healthcare so that rather than just focusing on the pain, we actually look at pain and function at the same time, and we're able to practice proactive health, meaning look at healthcare from a health-based focus. How do we maintain health? Not just how do we fix disease. And if we just focus on fixing disease, that means we're going to wait until people get to a point where they have disease before we do anything for them. We wait until the engine breaks down before we change the oil. And we need to move things upstream. We need to start looking at structures when they start to hurt and understand why they hurt so that we can prevent them from breaking down even further. Ice, for instance, feels better.
Yeah.
When you're really inflamed,
did.
ice feels better. But it's actually problematic because it's making it harder for your body to heal. So I usually recommend, if you're going to use ice, recognize that you're just using it to calm the symptoms down. But don't think that there's going to be a therapeutic value to it. So don't overuse it.
No, I was using it every 20 minutes.
Yeah.
And I was trying to walk and go get it. And I was
And if we can take your motivation to keep going and combine it with really solid understanding of how this knee is functioning and how we can stabilize it so that the motivation you have is actually building healthy tissue as opposed to breaking down weak tissue, then we can have situations where we may be able to offset the need for knee replacement for years. Or we may be able to get your knee strong enough to where you never need it. But it means taking a different look at how do we manage these problems and try to manage them in a way that's more thoughtful about the condition, not just the pain and symptoms. Yes?
So basically what you're trying to study, I don't mean to brag, but my dad, he worked for the health department, Dr. Leach.
Yeah.
And he designed a needle exchange program. So like a person with AIDS is not using the needle and then passing it on to somebody else. He designed a system to where they bring the needle in and they give them the clean one so it doesn't circulate. It just goes in the trash.
Right.
You know,
So it's that kind
it's
of a
not
mindset.
the perfect system,
Right.
but he found a way to stop it from keep
Evolve.
going.
Dr. Leach, Rice,
Yeah.
correct?
Dr. Rice Leach.
He is one of my heroes. I have a lot of respect for him. He's a great man. And what he did for our community is tremendous. I have to commend him on that. So
Thank you.
thank you.
thank you,
Yeah.
because
no,
he's gone.
I know. It's a tragedy for the entire community.
Yeah.
He was president while I was really active in the Lexington Medical Society, and I got to know him very well. And tremendous man, huge heart, incredible man. I think that's wonderful that you had such a great role model in life.
Well, thank you.
Thank you. That means a lot.
Yeah.
Because we try to keep on going all the time, even though the people that we loved is gone.
Yeah. Legacies are important.
Yeah.
What you leave behind, whether it's contributions to society or connections with people, the intensity of love that you create around you, I think that's really important. And recognizing that when that person is present, as well as when they're gone, is tremendously important. Yes.
I don't know who it was, but if you go on YouTube and look up Dr. Rice Leach's jazz funeral, it tells all about it. Then somebody else in the news media put that when he died, and then there's a list of interviews. And he knew how to handle the news media.
Oh, yes, he did. He sure did. I think he had a good handle on handling everybody. He was very, very tactful, but very direct. I think he would. I follow his lead and how we approach healthcare, and that's a more mindful way of doing things as opposed to just falling into patterns and routines.
Well, if you're interested in looking at plaques, I got them hanging all right over there.
I bet.
But behind that wall is my room, which is a studio of all his awards that he was given.
Well, it's clear
And
he left a legacy of pride with you.
Yeah.
It's fantastic. Does anybody have any other questions about the musculoskeletal system, the nerves in our body, how these things cause pain?
I do, as a
Yeah.
matter of fact. When they put the metal knees, what muscles are there that we ought to watch for?
So ideally they reattach all of those muscles, and they
Okay,
should all be functioning and firing correctly.
okay,
But it's important to maintain exercises because one of the things that you lose with a mechanical knee is the ability to feel where your knee is in space. And sometimes,
tell me about it.
yep, and sometimes what can happen is that you don't realize that you're overutilizing some muscles and underutilizing others. And so you can create other problems. But so it's really important to maintain the exercises they taught you in physical therapy. Physical therapy and exercise is really the most fundamental way you can stay young. Because just simply moving gets circulation going, moves muscles in and out so that you can kind of compress all the toxins out and absorb all the nutrients. So exercise has been proven. If you were to do one thing in your life, it's to maintain exercise. It's the one thing that's been absolutely proven to create greater longevity as well as sustain the health that you have.
But let me ask you another question.
Sure.
What do you do when you were using pointed shoes and standing up on your toes?
Yeah, that's a great question. So we all have a tendency, all of our shoes have a kind of a wedge to them. We're all tilted a little bit forward, which isn't really good for the rest of our body. Not just the feet, but really the entire body. So I'm a big advocate of flat shoes. I'm not wearing them today because I'm at work, but as much as I can, I try to stay flat. Now, there's a point in time where there's no point in trying to adapt because it's just things are now fixed or hard. So if you find that, for instance, walking barefooted or on flat shoes is making things worse, you might want to temper that and balance it with like maybe a few minutes a day with flat shoes and then progressively build it up. You just have to remember that body is constantly adapting, and if you give it certain stresses, it can adapt to that.
I've noticed
Sure.
women have gone from a 2-inch to wear their shoes basically like this.
Yeah, they're like on their tiptoes. I don't know how they
Almost.
maintain that, other than the fact that the body
And
adapts.
to raise this thickness. I don't understand. Does that cause sore damage to the body?
I think it can, but again, some bodies are built for certain resiliency more so than others.
Wouldn't mess up the feet?
I think it does, yes. Yeah.
Because
At some point
you're
down the road.
slanting your toes like this, basically.
Yeah, I
And
think
then the
at some
heels.
point we're going to look at shoes the same way we currently look at, the Asian cultures that would bind feet and try to keep them small. I think we'll look at shoes one day the same way.
Should we never put a pair of shoes on them?
So, they've looked at societies or cultures where kids grow up barefoot, and they actually have healthier feet than kids that grow up wearing shoes. So, yeah, I mean, I'm not gonna advocate people going around barefoot, but there's some value to having those conversations and thinking the mechanics through. I haven't done enough of that for me to be able to give advice on it, so I refrain from that. But I
Well,
do
the
try to
best-
wear flat shoes as much as I can.
The best thing is to get the rabbit skin and put on your feet.
Well, one day
That
we'll go
will
back
be
to
comfortable.
well, one day we'll go back to living in tents and hunting and
Yeah.
me neither.
I won't go that far.
Well, I grew up in the country and I never wore shoes.
You've got great feet. Yeah. All right. Well, I don't want to take too much of everybody's time. We're about up. But if anybody has any other questions or concerns, by all means, reach out to us. We want to be a resource for the community. And if you have any questions about Miles, Jay is the representative for that.
If you could just kind of talk, closing with Miles, talking about,
Sure.
you know, the anesthesia part,
Oh, yeah.
the stitches.
Yeah, that's a good point.
And maybe about your training. People are always interested. You have a great background in training.
So I grew up in Kentucky, and my parents are actually both anesthesiologists, and they started a pain practice. So I grew up in that full environment, but they had a very different approach of doing things than what's kind of in the news right now. In fact, I've been a big advocate for changing all of the whole ways that we've been doing things. But I went away to school to Johns Hopkins, and then I did my residency there, and then I did my fellowship down in Houston at MD Anderson, which is a big cancer institute. And so my interest was always complex pain scenarios. But then once I came back to Kentucky, I wanted to try to make a dent in the whole way healthcare approaches pain. And that's why I came back here, because we have such a big problem with it. But once I got into my own practice, I realized that even the training that I had, even though it was top-notch training, still had some big gaps in it. And so that's why I started to look at more of the musculoskeletal stuff and how the body mechanics work. And that's really changed how I practice. As far as the other question that Jay asked about, you know, how this procedure actually, the mild procedure actually takes place, as opposed to surgery, which would require general anesthesia, putting a breathing tube down, you'd probably stay in the hospital overnight. There are lots of risks of blood clots and infection. With the mild procedure, it's something we can do in an outpatient setting. I do it under local anesthetic, and people walk home on their own that same day. So it's much, much less risk. In fact, there have been, 20,000 cases with 0 complications?
Over 13 studies with no major complications,
Yeah.
and there's no stitches.
Yeah.
So
but
it's a needle stick. Our studies, I don't mean to, I don't want to take the floor from Dr. Donish, but our studies show better, actually, and the results you've seen, probably 70-80% success rate.
Yeah.
It's the only procedure, and I've been in healthcare for a long time, the only procedure where I can name 4 physicians I know myself that have had the procedure done on them. And I ask a physician today, how many physicians do you know that have a spinal cord stimulator? Couldn't think of any. How many physicians do you know that have had a spinal fusion? Couldn't name one. I don't know. Those treatments are necessary sometimes, but this is a needle stick procedure with just some local numbing medicine to the skin Dr. Donish uses, and again, there's no stitches, no implant, no overnight stay, and my parents are gonna have it done. So for you, one of those 20% that doesn't work on, it was a needle stick.
Yeah.
You can't take those big surgeries back. You can't take that piece of lamina off your spine and put it back. So, but it is like Dr. Donish said, the patients you see leaned over because they get that relief. So if you can't stand very long, you can't walk very far, and you get relief, and you sit down or lean forward. And we all have friends. My mom's a perfect example of it. And so you can speak to your results. I don't see your patients, but you've been very happy with it.
Yeah, I would say probably 80-90% do phenomenal. I've had patients where we've done this procedure, they've been going to pain clinics for years. We see them, we do this procedure, and I just don't see them back because they don't need to come back. They don't need
There's people that use a rubber thing on the leg, and they walk like this.
bracing, yeah,
What is that for?
for a wide variety of things. You're talking about bracing around the knee, correct?
No, they put the rope over the bottom of the feet, and it goes up like this, and they have something to hold on, and they walk with it.
Huh.
I
Not
have
sure.
seen people doing that.
I'm not sure. I haven't seen that, or maybe I'm not following the description. But we can talk about that
Like
afterwards.
this.
Maybe
Okay.
that's for strokes.
Huh?
I could see that being for strokes, like if you lose function in your legs and you
Yeah.
need your arms to compensate for the leg.
Right.
That's my guess.
There are some flyers up there, as Dr. Donish, as far as questions that they
Yeah.
can respond to. If you know anybody, or if you yourself maybe are suffering from some of the symptoms that Dr. Donish and Jay mentioned, it kind of just gives you an idea of maybe what to be looking for in yourself or in a loved one.
Well, I won't. I see. Thank you.
Yeah.
You're very welcome.
This is a newer procedure, so not a lot of people are aware of it.
I got one.
Okay.
More or less like this.
Not a lot of people are aware,
And the thread was
That it
here,
exists.
and they were holding it.
and they have surgery instead of something
Yeah.
like this first.
And I saw them
so
walking, but
What we're
I
trying to
don't
do
know what they were
is
using.
create the awareness about this procedure, because it's certainly worth trying before surgery. For many patients, it's really the only thing they need. And then for those patients for whom it doesn't work, you can always go back to surgery, but you can't go the other way around. Well, I won't say that. You can go the other way around if the problem's at another level, but you can't fix the same problem at the same location. Going the other way, starting with surgery and then trying this.
If I don't have any trouble, as far as I know, with walking, but isn't walking probably just plain walking the best thing you can do for yourself to keep yourself going?
To answer that, it's a tough question to say it's the best thing to do. It's certainly better than doing nothing,
Mm-hmm.
but people have different needs, and for some people walking is the best exercise they can do. Some people swimming is better. For some people just simply sitting in their chair doing exercises is better.
Mm-hmm.
It just depends on the situation.
Mm-hmm.
But any movement, any exercise is better than no exercise.
Yeah.
I walk around the block every day.
That's great. Secret to it's your fountain of
Nobody else
youth.
would go with me.
Everybody should go walk with, what's your name?
Barbara.
Everybody should find Barbara and go on a walk with her.
Where I
tried that
lived,
once and they wouldn't do it.
where I lived before I came here, they had a walking path that I walked every day with somebody and another person, and
That's great.
I always felt better when I walked.
It might not feel, if you haven't been walking for a while, it might not feel great when you start walking, but I guarantee you after a couple of weeks it will. And you and Barbara could go outside on the grass and just walk enough times where you start to make your own path, and then you have a walking path.
I would like to see that.
treatment for arthritic people.
It depends, because arthritis leads to stenosis, so it just depends on which one is more problematic. But it's certainly we want to evaluate and see what's more problematic and start there. And if we can catch the arthritis and treat it early, you might not develop stenosis to need this, but it just depends on.
Unfortunately, that's already happened. Not
it's-
for me, but for a person I know.
By all means, share this with your friends, because like I said, not a lot of people are even aware of what we can do, and so going through the standard wheels of healthcare, a lot of people don't get exposed to some of these newer techniques.
How do you feel about this CBD oil
There's a lot
situation?
of talk about it. It's a little bit overblown. There is value to it, but there haven't been enough studies to show who's going to benefit from it, who's going to get harmed by it. So for that reason, I really caution against using the term medicine around it. But there is value, and I've seen patients who've used it and benefit from it, but it's not an easy conversation. It's something that really I recommend talking to a doctor about a specific condition and seeing if it's worth trying or not. There's just a lot of people making a lot of money about it, and anytime that's the case, I always take some caution against, you know, the claims that are being made. All right.
Guys, thank you all so much for coming. We enjoyed being with you all today.
Yeah, thank you for having me.
Well,
Appreciate it.
thank you for coming.
My pleasure.
That's the other
My
one.
pleasure. You guys can return the favor by telling other people as well, because this is we're on the other side of town. Do you remember the Eagle Creek Library across from St. Joe East?
Yeah.
We're in that building. Yes.
Well, since you said pass the word on, I'm gonna pass the word on to my friend. He just recently signed up for martial arts, and he's learning a technique in his martial arts class that's helping, plus the hemp oil that's helping one of the things he has. It's to where it's lessened, but since he's gonna be doing a lot of different things with his body, I'm gonna pass one of these on, because he hasn't done it for years, and now he's gonna start up again, sprawling and stuff like that. He taking up martial arts. He's gonna be competing against other people for,
Yeah.
you know,
Well,
he's
wish him well, and if he has any pain issues that are going on for more than a couple of weeks, tell him to get in touch with us so we can figure out what's going on before it goes on.
I'll
too long.
just give him this.
You could do that too.
Unless
It doesn't
you
have
a
that doesn't have
business
Do
any
you
other
want
contact.
cards?
I was gonna say I'll give you guys some business cards. They're in
Yeah.
they're up there in the Healing Beyond Medicine in the middle too, Dr. Donish. We can pass those out.
Sure. Does anybody go on Facebook? So if you go on Facebook, if you go to our page, every other week I do a talk about something, and you can actually ask questions or call in. It's called the 50 Shades Show, because I wrote this book called 50 Shades of Pain, How to Cheat on Your Surgeon with a Drug-Free Affair. And it talks a little bit more in detail about our approach as to how we do things. And were we gonna do a giveaway?
Yeah, I'd actually like, before everybody leaves, is just kind of as we're closing up and Dr. Donish is getting his things, I've got some little forms there if you guys don't care to leave me your name and contact information. I'd like to just draw out of a hat and come back over later in the week and give you guys a little prize for just showing up.
These are really small.
Are they tiny? I'm sorry. And I may have to, I think we have an ink pen up there, but I actually may
Yeah,
need to
there's an
steal
ink-
you a couple of
there's
more. I have
more
some
ink
more
pen.
pens.
Okay, I can pass it over.
Thank you.
Thank you.
Thank you.
I've got some ink
Thank
here
you.
too. I think there was
You're
one
welcome.
there as well.
Here's one.
And then I'll give you guys some business cards too.
Yeah, she'll do a drawing.
That's what I want.
The business card? Yeah, absolutely. Please, here. Of course.
And you can get this book on Amazon if you're interested.